In this video, we will explore the complex topic of intestinal polyps. These abnormal growths can be found throughout the gastrointestinal tract and have various characteristics and clinical implications. Understanding their types, management, and genetic associations is vital for medical professionals. Let's begin our comprehensive exploration. Adenomatous polyps are common in the gastrointestinal tract. They have a glandular structure with different subtypes. Their potential for malignancy depends on size, dysplasia grade, and certain genetic mutations. Understanding these features is important for patient management. Hyperplastic polyps are generally benign and have little malignant potential. They show glandular overgrowth in the gastrointestinal mucosa, with serrated or sawtooth patterns. Certain subtypes may have an increased risk of progressing to colorectal cancer, requiring appropriate management and surveillance. Familial adenomatous polyposis, FAP, is an inherited disorder causing many polyps in the colon and rectum. It is caused by mutations in the APC gene, leading to a high risk of colorectal cancer. Early diagnosis, genetic testing, and prophylactic colectomy are important for management. Lynch syndrome, a genetic disorder caused by mutations in MMR genes, increases the risk of colorectal and other cancers. Individuals with Lynch syndrome require regular colonoscopies for early detection and treatment of polyps and cancers. Serrated polyps, including hyperplastic polyps, sessile serrated adenomas, and traditional serrated adenomas, are a diverse group of lesions. They are important to study due to their link to interval colorectal cancer and specific molecular changes. Differentiating between subtypes helps with risk assessment and surveillance planning. Inflammatory bowel disease, IBD, patients are at risk of developing polyps. These can be sporadic or IBD associated. Diagnosis and management involve surveillance colonoscopies. Understanding their characteristics and providing appropriate management strategies is crucial in preventing disease progression and reducing the risk of cancer. Endoscopic polypectomy is a commonly performed procedure for the removal of gastrointestinal polyps, enabling both diagnostic and therapeutic interventions. Various techniques, including snare polypectomy, endoscopic mucosal resection, EMR, and endoscopic submucosal dissection, ESD, are employed depending on the size, location, and morphology of the polyp. While endoscopic polypectomy is generally safe and associated with a low risk of complications, it is essential for endoscopists to be aware of potential adverse events such as bleeding, perforation, and incomplete resection. Understanding the indications, techniques, and complications of endoscopic polypectomy is crucial for achieving successful outcomes and reducing the likelihood of disease recurrence. Polyposis syndromes encompass a group of hereditary disorders characterized by the development of multiple polyps throughout the gastrointestinal tract. These syndromes can be divided into hamartomatous and adenomatous polyposis syndromes based on their histological characteristics. Examples of hamartomatous polyposis syndromes include Peutz-Jeghers syndrome and juvenile polyposis syndrome, whereas adenomatous polyposis syndromes include FAP and MUTI-associated polyposis. Understanding the clinical manifestations, familial patterns, associated genetic mutations, and cancer risks associated with different polyposis syndromes is crucial for accurate diagnosis, appropriate management, and genetic counseling of affected individuals and their families. After the removal of adenomatous polyps, appropriate surveillance is crucial to detect and manage recurrent polyps and early-stage colorectal cancer. Surveillance intervals after polypectomy depend on various factors, including the number, size, and histological characteristics of the polyps, as well as the presence of high-grade dysplasia or genetic mutations. Evidence-based guidelines provide recommendations on surveillance intervals based on these factors. However, there are ongoing controversies regarding the optimal surveillance strategies, particularly for patients with low-risk polyps. Balancing the risks and benefits of surveillance, along with patient preferences, is essential in order to develop personalized surveillance plans that optimize patient outcomes. Advances in molecular biology have contributed significantly to our understanding of colorectal carcinogenesis and the identification of molecular biomarkers that aid in the risk stratification of polyps. These biomarkers include genetic mutations, microsatellite instability, DNA methylation, and specific gene expression patterns. The integration of molecular biomarkers with histopathological evaluations can improve the accuracy of risk prediction, guide surveillance strategies, and potentially aid in therapeutic decision-making. However, the implementation of these molecular biomarkers in routine clinical practice requires further validation and standardization. Here, we explore the current status, emerging trends, and future implications of molecular biomarkers in polyp risk stratification. While polyps are typically protruding lesions, colorectal neoplasms can also manifest as nonpolipoid lesions, such as flat or depressed lesions. These nonpolipoid lesions pose a challenge in terms of detection, as they can be more difficult to identify during colonoscopy. Moreover, there is evidence to suggest that nonpolipoid lesions have an increased risk of aggressive behavior and interval cancer. Improved imaging techniques, such as chromoendoscopy and high-definition endoscopy, have enhanced the detection rates of flat and depressed lesions. Understanding the identification and management strategies for nonpolipoid lesions is crucial for improving the early detection and outcomes of these potentially aggressive colorectal neoplasms. Small intestine can also develop polyps like the colon. Polyps can be classified into adenomas, hyperplastic polyps, hamartomas, and neuroendocrine tumors. Diagnosis requires specialized imaging. Treatment and surveillance depend on size, histology, and symptoms. Optimal patient care requires understanding of characteristics and management. In conclusion, understanding intestinal polyps is crucial for gastroenterologists. Recognizing genetic syndromes and using molecular biomarkers can improve early detection and prevention of colorectal neoplasms, leading to better patient outcomes. Let's continue exploring this field for our patients' sake.